which is a typical intercostal nerve. Today we are going to do anatomy MCQ challenge. This anatomy is a very important subject as far as NEET PG is concerned. At least 15 questions, 15 to 17 questions are from anatomy. 15 to 17 questions is a very good number as far as anatomy is concerned. And if your anatomical concepts are good, you will be able to solve many questions, many MCQs in different subjects also, especially orthopedics, surgery. If your anatomy is good, you can solve the MCQs, obstetrics and gynecology. If your embryology part is good, you can do the congenital heart disease part of pediatrics very well. So let us begin with the first question. Which is a typical intercostal nerve? A. First intercostal nerve. B. Second intercostal nerve. C. Third intercostal nerve. And D. Seventh intercostal nerve. Typical intercostal nerves are the ones that are confined to their own intercostal space in the thoracic wall. The third, fourth, fifth, and sixth intercostal nerves are typical intercostal nerves. Third, fourth, fifth, and sixth intercostal nerves are typical intercostal nerves. So the correct answer here is third, that is C. So now let's move to the next question. Trendelenburg test is positive in due to injury of which of the following nerves? This Trendelenburg is very important as far as orthopedics is concerned. Anatomy also the question is asked. Now what does a positive Trendelenburg test indicate? A positive Trendelenburg is relatively non-specific and may indicate pain due to osteoarthritis of hip joint, weak hip abductors. What are the hip abductors? They are gluteus medius, gluteus minimus, short femoral neck or fracture of neck of femur, dislocation or subluxation of hip, neuropathy. Gluteus medius and minimus are supplied by superior gluteal nerve. Normally, when a person is made to stand on one leg, the hip abductors of the ipsilateral side raise the opposite and the unsupported side of pelvis. If the abductor mechanism is defective, the unsupported side of pelvis drops down. This is known as positive Trendelenburg test. So Trendelenburg test is positive due to injury of superior gluteal nerve because superior gluteal nerve supplies the gluteus medius and minimus, which are the abductors. So the correct answer here is C, superior gluteal nerve. Which among the following is not a branch of arch of aorta? Now, branches of arch of aorta is a very important topic. A. Brachiocephalic. B. Right common carotid. C. Left common carotid. D. Left subclavian. See, the arch of aorta begins at the level of upper border of second sternocostal articulation of the right side. The arch of aorta begins at the level of upper border of second sternocostal articulation of the right side. The branches given off from the arch of aorta are three in number. They are number one, brachiocephalic artery, which they nominate the left common carotid, the left subclavian. Brachiocephalic artery is the largest branch of arch of aorta. Left common carotid artery and left subclavian. This brachiocephalic artery divides into right common carotid and right subclavian artery. So this right common carotid artery is not a direct branch of arch of aorta. Let us move to the next question. Boundary of Koch triangle. Now these triangles are very important in anatomy. Boundary of Koch triangle is not found by A. Tricuspid valve ring, B. Coronary sinus, C. Tendon of Todaro, D. Limbus fossa ovalis. Boundary of Koch triangle is not formed by A. Tricuspid boundary, B. Coronary sinus. Now, this Koch triangle is a triangle which is enclosed by the septal leaflet of tricuspid valve, the coronary sinus, and membranous part of interatrial septum. Koch triangle, Walter Karl Koch, 1880-1960, was a distinguished German surgeon who discovered a triangular shaped area in the right atrium of heart that marks the atrioventricular node, also known as Koch triangle. The Koch triangle, the three sides of triangle are defined by following structures. The ostium of coronary sinus posteriorly, the anterior portion of tricuspid valve ulnus, the tendon of Todaro. What is tendon of Todaro? A tendinous structure connecting the valve of inferior vena cava ostium to the central fibrous body, posterior. So the importance is it is an anatomical landmark for location of atrioventricular node during electrophysiology procedure such as pacing or ablation. So the correct answer here is limbus fossa ovalis. So boundary of Koch triangle is not found by limbus fossa ovalis. Sympathetic supply to heart arises from which of the following spinal segment? A. T1 to T5, B. T2 to T6, C. T3 to T7, D. T4 to T8. Sympathetic supply. Sympathetic supply to heart arises from which of the following spinal segments? It is A. T1 to T5. Inferior pancreaticoduodenal artery. Inferior pancreaticoduodenal artery is a branch of which of the following arteries? A. Splenic artery. B. Left gastric artery. C. Gastroduodenal artery. D. Superior mesenteric artery. The correct answer here is D. Superior mesenteric artery. Inferior pancreaticoduodenal artery is a branch of superior mesenteric artery. This inferior pancreaticoduodenal artery supplies the pancreas and adjoining part of duodenum. Its anterior and posterior branch anastomose with the branches of superior pancreaticoduodenal artery. This anastomosis is the only communication between arteries of foregut and midgut. Now, what are the branches of superior mesenteric artery? The branches of superior mesenteric artery are inferior pancreaticoduodenal artery, B. Jejunal and ileal branches, C. Ileocolic artery, D. Right colic artery, E. Middle colic artery. Inferior pancreaticoduodenal artery, jejunal and ileal branches, ileocolic artery, right colic artery, middle colic artery. So the correct answer here is superior mesenteric artery. So what are the branches of superior mesenteric artery? They are inferior pancreaticoduodenal artery, jejunal and ileal branches, ileocolic artery, right colic artery, middle colic artery. Now, facial nerve is a derivative of which of the following branchial arch? A. First arch, B. Second arch, C. Third arch, D. Fourth arch. Facial nerve is a derivative of which of the following branchial arch? Facial nerve is a derivative of second branchial arch. The muscles of facial expression are derived from it. They are the buccinator, the auricularis, frontalis, platysma, orbicularis oris, orbicularis oculi. Additional muscles supplied by it are the stapedius, stylohyoid, posterior belly of digastric. So the correct answer here is second arch. Which of the following nuclei belong to general visceral efferent nuclei? A. Facial nerve nucleus, B. Trigeminal nucleus, C. Dorsal nucleus of vagus, D. Nucleus ambiguus. The correct answer here is C. Dorsal nucleus of valgus. The visceral efferent fibers, also called general visceral efferent fibers, convey sensation from alimentary tract, heart vessels, and lungs by way of nerves 9 and 10. A specialized visceral efferent component is involved in sense of taste. Fibers carrying gustatory impulse are present in cranial nerves 7, 9, and 10. The general visceral afferent column is represented by part of dorsal nucleus of vagus nerve. So the correct answer here is C. Internal anal sphincter is a part of A. Puba rectalis, B. Deep perineal muscle, C. Internal longitudinal fiber, D. Internal circular fiber. It is internal circular fiber. Which structure passes behind the inguinal ligament? A. Femoral branch of genitofemoral nerve, B. Femoral vein, C. Psoas major, D. All. It is all. There is an ultimate Neet PG breakthrough blueprint event is there on January 30 and 31st. Please click the link in the description box to join and to know more about the event. It is the most valuable event occurring. You will you will enjoy that, and the you will enjoy the event very well, and it will be a thorough revision of the Neet PG. Posterior communicating artery is a branch of A. Internal carotid, B. External carotid, C. Middle cerebral, D. Posterior superior cerebral. It is internal carotid. Primary and secondary palates are derived by A. Greater palatine foramen, B. Canine teeth, C. Alveolar arch, D. Incisive foramen. It is incisive foramen. The right suprarenal vein drains into A. Inferior vena cava, B. Right renal vein, C. Right gonadal vein, D. Left renal vein. It is inferior vena cava. Oribach plexus is present in A. Colon, B. Esophagus, C. Stomach, D. All of the above. It is all of the above. It is present in all of them. Intercalated disc is present in A. Cardiac muscle, B. Smooth muscle, D. Skeletal muscle, D. All. It is present in cardiac muscle. The intercalated disc is present in the cardiac. Which is true about the synovial joint? A. Stability is inversely proportional to mobility. Hyaline cartilage covers articular surface of all synovial joint. Metacarpophalangeal joint is a hinge joint. Cartilage usually divides the joint into two cavities. Its stability is inversely proportional to mobility. Nerve supply of stapedius is A. Second nerve, B. Third nerve, C. Fifth nerve, D. Seventh nerve. It is seventh nerve. Small muscles of hand are supplied by C3, C4, C6, C5 to C7, and C8 to T1. It is C5 to C7 and C8 to T1. Structure passing to deeper to flexor retinaculum at rest is A. Ulnar nerve, B. Median nerve, C. Radial nerve, D. Ulnar nerve. It is median nerve. Agiogous vein drains into right subcostal vein, B. Superior vena cava, C. Brachiocephalic, right ascending nerve. It is superior vena cava. Agiogous vein drains into the superior vena cava. Superficial inguinal ring is a defect in. Well, this is a very simple question. What is the correct answer here? It is external oblique aponeurosis. Ovarian artery is a branch of abdominal part of aorta. Please attend the 2-day Ultimate Neet PG Breakthrough Blueprint Masterclass. Click the link in the description box. Meckel's cave is related to trigeminal ganglion. Medulla oblongata is derived from A. telencephalon, B. diencephalon, C. mesencephalon. It is myelencephalon. Longest spinous process is seen in C7.